If you work with or around dairy cows, chances are you might have heard about or even dealt with dystocia before. But what exactly is dystocia? And why is it so important for it to be managed well on the farm? Dystocia is when a cow experiences a difficult labor, sometimes requiring moderate to severe assistance during calving. For those who aren't familiar with the condition, they might wonder, what's the big deal? But dystocia can have some really important impacts on cows, calves, and the producer's bottom line. Research shows that after experiencing dystocia, cows produce significantly less milk over their lactation, and their milk is typically of lower quality with less milk fat and milk protein. Dystocia can also reduce fertility due to impacts on the uterus and delayed return to normal ovarian function, meaning it can take longer for the cow to become pregnant again. Due to their lower milk production and poor reproductive performance, these cows are often at higher risk of being culled from the herd. Finally, due to the injuries that can result during labor, cows that have experienced dystocia are often susceptible to other conditions and diseases such as retained placenta, metritis, mastitis, and milk fever. Now that we know about the impacts for cows, what about the impacts on the calf born from a dystocia? From the get-go, these calves have a higher risk of death at birth and in the first 48 hours of life, and even up to 120 days when compared to unassisted calvings. These calves also typically have reduced vigor, meaning they may not suckle well and consume an insufficient amount of colostrum and milk. This can result in failed transfer of passive immunity, whereby the calf does not receive enough antibodies to protect itself from disease. This can put the calf at increased risk of other health problems and diseases. For instance, calves born from a dystocia are more likely to need to be treated for digestive and respiratory diseases compared to calves from unassisted calvings. Finally, over their lifetime, calves born from a dystocia have been shown to produce significantly less milk in their first lactation compared to normal calvings. Knowing all this, it's pretty clear that there are some important health and well-being impacts of dystocia for cows and calves. Costs and lost income can add up from cows that produce less milk, have a longer time to subsequent pregnancies, or that become sick or die, making this a condition that affects everyone on the farm. So, what can you do to reduce the impacts of dystocia? First, prevention through excellent calving management and calving supervision is critical to reduce the need for more severe levels of assisted calvings. Second, for cows already experiencing a dystocia, proper use of pain management can help limit the short and long-term effects of this condition. Finally, for anyone that manages dairy cows, make sure to talk to your veterinarian about best practices for preventing and managing cows on your farm in the event of dystocia.